What's going on, everyone? It is the end of week 6 here. I just want to recap it in this video for you guys and give you my experience and everything. First thing I want to say real quick though, this is just my experience and my approach with my healthcare team. Don't take this as advice. It's not medical advice. If you see anything in these videos that you think you might want to try for your rehab, I would ask your doctors or PT or both before doing so, and just take their advice on that and work with them on those things. Don't just following things on the internet blindly. So yeah, not medical advice. All right, so first thing I want to touch on the goals for this week, and I didn't really touch it in last week's video, week 5. So I kind of want to cover that real quick here. So in week 5, my goal was to walk without crutches, and obviously I did not hit that. If you saw last week's video, I'm still using crutches, but that's mainly because of my restrictions with, with my meniscus repair. So for my doctor's guidelines for recovery. So week 4, you can start weight bearing at the end of week 4, sorry. And then, weeks 5 and 6, you're gonna be only 50% weight bearing. So you have to walk with at least one crutch. Just make sure you don't have too much pressure there on your leg. I guess that's kind of the thought process, and they want it to have enough time to heal, I guess. So yeah, that wasn't really an achievable goal, which at the time I wasn't fully aware of. And yeah, so that was something I set myself up for failure there, which I'll get into some more later on in kind of weekly recap here as I'm going. So week 6, my goal is at the end of this week to start walking again. At the end of week 6, I can start walking without a crutch, so I want to be ready for that when the time comes, and I'll get more into that later on in the video. In my week 7 goal for next week, so I want to continue my exercises and progress into harder things. I'll touch more on this, but week 5 and 6, I was a little disappointed with my exercises, but that was more of my lack of understanding on where I'd be progressing at this point. So week 7, I want to continue the progression, hopefully into some harder exercises and start nailing those down. And I also want to push my flexion range of motion. So I'll get into it here, but I just want to keep that flexion going further, and I'll talk more about that later in the video. So pain levels, I want to cover that real quick. If you're looking at this for yourself in the future or anything, you can get scared of the pain level. So I just want to touch on that every week. Pain, pretty easy this week. There has been one little issue that kind of was nagging me, but overall pain levels are pretty low. If I'm just hanging around, I don't even notice my pain at all. Like, I don't think my knee, it's not normal knee, obviously, yet. I'm still rehabbing, but pain doesn't really pop up in my mind ever, usually. But there was something that I'll get to here in a second. So behind my knee and kind of towards the back here, which I got my phone set up to record me here, but I'll try to show you guys. So kind of like back here in this region, kind of, where the knee bends, and kind of the back of it towards the outside here. So my lateral side, there was a pain there that was kind of bothering me for, the first 4 or 5 days of the week. And it made doing leg raises, flexions, heel slides not pretty painful, but there was pain there, and it kind of like made me hesitate and not really want to do those exercises as much. And then around week, day 5 of this week, so around day 40 overall since surgery, there was a pop while doing my straight leg raises. So I was doing my leg raises, initiating them was painful because of that pressure and pressure point back there. I don't know, it's kind of like a not great feeling, not like stabbing, but kind of down that road of pain. And I did a leg raise, and it just popped as I was raising up, and it was a pretty loud pop, and it was, I don't know, it just felt kind of jolting a little bit. And after that, the pain has kind of subsided. I don't feel that pain really anymore. There's some discomfort back there, but nothing painful per se. the explanation I got for that was, so originally it was the calf attaches there. And that could be cause of the pain, because that's when I started doing calf raises that introduced this pain. And maybe like the attachment back there for like the calf muscles kind of maybe making it not feel too great. And I also saw my doctor at the end of the week 6 here for my follow-up, and her explanation was that it was potentially, you know, the hamstring comes down and attaches back there. So there's a bunch of different things that could be playing with that, and it's not something to be scared of per se, but it's something that is normal and, you know, can come and go over, you know, a couple months of rehab here. That's what my PT said, at least. My doctor didn't really touch on, you know, whether that's a recurring issue that could happen, but I trust my PT, and he said it's something that, you know, don't be discouraged by it, don't be afraid, but it could come back, and it just comes and goes kind of thing. But I think just the swelling and, you know, being manipulated with surgery, things just aren't really in the right spot yet, or maybe they are, and things are just, you know, trying to find their place with this new kind of setup with my knee, and I just got to work through it in the rehab. And this is something that doesn't really play into pain levels, but I want to put it here. So my knee is still very stiff. You know, if I'm sitting with my knee bent for a long period of time, then getting extension takes a while. You know, not like an hour, but, you know, it takes me 5 minutes of sitting there at least to kind of really get it down to like 0. And kind of the same with the opposite direction. So if I'm straight for a while, bending, you know, it's really tough at first. So I think it's something normal. Just want to touch on that. My knee's pretty stiff still. I think the amount of stiffness you have could be more so tied to your exercising and like what you're doing. But I think keeping swelling down is one of the key aspects for that stiffness. But I think it's pretty normal at this stage of things. So the next thing I want to touch on is my exercises and my walking for the week. So I'll put some clips here, my exercising. So this week, no new major exercises. I have had some variations introduced. So just doing things in different, you know, manner. Not really new exercise per se, and I don't really know if it really pushes, you know, my muscles more. Just a new method for working some of these different exercises and muscles. So I have my exercise list there kind of towards the right. So I'll run through those real quick. So I got my straight leg raises, sideline leg raises, which is more of your hip abductors. I got knee extensions, so my normal, just basically like quad sets is kind of like a form of that. Laying on my stomach is another form of the knee extension, sorry. I also this week had an introduction of doing knee, like, you know, heel props. So like let your knee hang down to get that extension worked out and stretch everything there. And while also doing that extension, or that knee hang, sorry, I was also introduced to doing knee extensions in that manner. So kind of pushing down with my heel propped up, you know, and also while doing those knee hangs or heel props, however you want to call them, my PT has reminded me that, you know, you can put a weight over your knee to kind of help drag the knee down. You can push, all that stuff, which I've done in my prehab routine before I had surgery. And, you know, it's not a pleasant thing doing that. Right now, my knee extension is pretty good, so it's not too bad, but he kind of lightly pushed on it at PT just to kind of show me. And that, I would say, felt worse than whenever I pushed on it during my prehab. And I was having a hard time extension in prehab, and the pain was, you know, sitting there for 5-10 minutes with my knee hanging, my heel propped up during prehab was pretty painful, I'd say. Now it's not too painful. You know, if I'm stiff, it'll be a little painful, but just sitting there, it's not too bad. But the pushing down, I haven't really done that on my own yet, but when he pushed it down in PT, that was a little painful. I'll say that more than the prehab. Hip adductors, another exercise. Heel slides. So I have some new variations of that. So doing the normal heel slides with your strap. You can do it without strap to kind of work the muscles harder. The strap is better, I think, in my opinion, for pushing your range of motion and getting that stretch there so you can get further bending. I have tried a new thing where I go to the wall and do a heel slide essentially. So you go like into the tabletop basically and let your knee kind of come down with, or sorry, your leg come down with gravity, so you're bending your knee more. That one has helped, I think. Just kind of get past, I was kind of stuck for a little while with the flexion, but that kind of helped me kind of get going again and get some more improvement. The heel slides are getting easier again at the end of the week here, and I can really push it again. I'll cover a little bit more on the flexion side of things in a little bit here. Calf stretches, not really an exercise, but that's something I do at PT. I don't really do it at home as much. Personally, I'm a pretty flexible person. Obviously things are really tight around my knee and this leg right now, but the calf stretches, I don't really feel a whole lot being worked there personally. Maybe I'm not stretching it hard enough, but yeah. Calf raises, so I've been doing those. And then I have these standing banded leg lifts, sideways, backwards, forwards. That's kind of a new thing that I haven't really done as much in the previous weeks, but have been really ramped up this week at PT. I don't have a clip for you guys, but it's just standing there, put a banded strap around your legs, and you're just doing sideways, leg raises, leg lifts, forward, backwards. It's a pretty simple exercise. Just add some resistance there with the band. And then some knee mobility work as well. So just doing like those stair taps that I've done, just working the knee range of motion, trying to get it back to normal, basically. And this week I achieved about 110 degrees of flexion so far. That's one update there. And these home exercises I do them about 3 times a day, and each time takes about 45 minutes. So it takes up quite a bit of time during my day. I don't do them as often just because I don't have a whole lot of time at home to do that while working. It's hard enough to fit in these 3 times a day and make sure I'm recovering and working at work. So it's what I'm working with right now. I think I'm doing all right. I think I'm progressing where I should be given the restrictions I've had so far over these last 2 weeks. So I don't think bumping up anymore is going to be not a huge thing I need to do right now. And for the walking, so my walking has improved. Hopefully you've seen a clip here, if not now, in a little bit. I think without the crutch, I'm doing pretty good. I don't really walk without the crutch, until the end of week 6 here. So I haven't had a whole lot of practice of those muscles and everything, but with the crutch, I'm feeling pretty good. If I'm stiff, it's difficult, of course, but the only thing that's kind of limiting there is, I think, raising up to my toe is kind of the hardest part with the walking. So it's kind of part of the calf raise thing. When I do calf raises to warm up, I'm walking pretty good. So yeah, the calf raises and making sure I get that extension. So if I'm stiff from not being able to extend too far, and if I'm a little weak in the calves, just warming those 2 things up and I'm walking pretty good, I think. And I'll get a little bit more into walking with my 6-week follow-up recap with my doctor that I'll do towards the end here. So next thing, flexion work. So the heel slides this week were, I don't know, I was just having a difficult time getting past the 90 with the heel slides. Later on I found out I'm just not pushing it hard enough, which I'll touch more in a few seconds here. So I tried a new method this week where I do the heel slides going down the wall, and that really helped me kind of push past 90 and kind of get past that barrier that I had, because I've been locked from 0 to 90. Really, I've been locked straight for 4 weeks, and then after that it was kind of 0 to 90 unless I'm doing exercises, and I can kind of push it more. So 90 is kind of like my safe point right now. It's even difficult to get there if I'm not working it. If I'm just out in the blue trying to bend to the 90, it's a little difficult, but I can get there pretty quick, within like 1 rep. That's kind of my safe point right now. So getting past that was difficult this week, and I introduced those wall slides, heel slides that helped a lot. And at my follow-up, which was yesterday, I'm recording this a few days after week 6, my doctor also told me about sitting in a wheelie chair, or a rolling chair, office chair, whatever you want to call it, and have your surgery leg planted on the ground about 90, and try to wheel yourself forward with your foot still on the ground. So use your unaffected leg to kind of help yourself roll forward and really push that bending that way. So you're kind of going forward on the chair, and that helps kind of, get your bending a little bit more. That's one method I haven't really tried. And now for that kind of thing I wanted to get into for the pushing this harder, the flexion harder. So the first day of week 7 PT, I learned that, I'm not really pushing the flexion harder, which we'll get kind of into my follow-up with my doctor in a second here. And it's not really week 6, but I want to put it here because this could be really beneficial for anyone at this point. I want to kind of hold this for a future video. I learned that I probably not pushing this flexion as hard as I should be. Early on, I was pushing it hard. It was painful. Things felt like they were ripping apart. And I think I got a little complacent and safe, when it feels comfortable with things, and I haven't really pushed it as hard lately. I've learned that I need to be, uncomfortable to the point where the pain level is getting a little high, and that's where I'm gonna make the most gains with this flexion. I can't really do a lot of gains, quickly, just sitting in my safe zone of 90 to 100 degrees, bending. I need to push it harder. So that's something I need to work on, and that's kind of part of my goal for this, week 7 look ahead. Pushing it harder, getting that flexion going. So mental update. This week, I was pretty frustrated, I'd say, with my lack of progression. This ties into not doing anything new for exercises, really. Haven't really pushed to things I thought I might be doing, like mini squats or anything, really working the muscle more than what I have been. I think these exercises are good for kind of maintaining, maybe building slowly, but they're not really gonna help build my muscle back. So I've been, expecting to jump into that stuff at this point because I'm feeling pretty good. Of course, doing these things first time will be probably not comfortable, but I think I'm kind of stagnating at this point, and I felt like I was wasting time doing these things over and over that I've been doing for the last 6 weeks since surgery, once I was able to get my muscles online and start firing. So that's been a frustration for me this week, and I think really it comes down to my kind of lack of awareness for restrictions that I'd have at this point, and what I would be doing at this point. I had an idea from looking online and watching videos on YouTube and whatnot that I'd be progressing a little bit further. I've seen some people that I know who had surgery recently progress a little bit quicker than me with exercises. So comparing myself to the online stuff has been kind of an issue with these frustrations. And I think I just wasn't fully aware of, what my healthcare team's approach was with some of these things. And I think that set me up for, some frustrations and whatnot on my end. So that's something I probably should have done a little better, is, ask some of these questions a little bit more in advance and make sure I'm on the same page as my healthcare team to make sure I'm not sitting here telling you guys I was frustrated this week and, have a bad week with that kind of thing. But I would recommend just, working with your team. Make sure you're aware of, what's going to come up for you and when, and kind of like, a rough timeline. It's hard to put a timeline on things because everyone's different, but just kind of ask them, where do you think I'll be at this point, So, and the last thing for the video here, my 6-week follow-up with my doctor. So technically I had it within the first day of week 7, but I think this is a good thing to throw in here because it's my 6-week follow-up. And I think it's a good kind of conclusion to this video. So now that 6 weeks are done, I have no more restrictions on range of motion, weight bearing, any of that. I can start walking without a crutch. They told me to ditch it. PT, they said, why do you even have the crutch? I walked in there with the crutch yesterday. And they said, just start walking, even though I kind of had contradictory input on that, because before he kind of said, use a crutch until you can walk normally, which right now I'm still kind of got a weird gait, which I think is a little bit normal for a little bit after going full weight bearing without a crutch. My brace needs to be worn while walking and exercising, so still need to keep my brace on. I can take it off for everything else. If I'm sleeping, just hanging around on the couch, whatever, I can take it off. I don't need to have it on 24/7 anymore. With that, my brace needs to be used for exercising and walking until I can do a straight leg raise without any, lag in the extension. They call it quad lag or extension lag, which I think is a little bit a weird term, but basically I'm not getting full extension while I'm doing my leg raises. So until I have that full extension, fully straight, no, 2 degrees bending, once I have fully straight, I can do a leg raise with that full extension with my brace on, so the added weight, then I can get rid of the brace for all my exercises and walking and whatnot. They'll probably be a little bit touch and go because I know I'm getting a brace for sports and whatnot for my doctor, so I'll have to kind of update you guys that a little bit more down the line once that's an issue. I'm clear to drive now, so I can start driving once I feel comfortable with that on my end. I think I'll probably start doing that within a few days here. I just want to make sure I can really bend my leg enough is kind of the issue. Just make sure I'm able to bend and move it quickly in case anything crazy happens on the road. So that's kind of what I need to test out on my end before I'm fully ready to go on that one. But I think it should be within a few days I'll be driving. So with my doctor, the flexion was not great. She was a little disappointed with that, I'd say. And I think really it's sort of normal at this point because I was locked straight, it has restrictions on the bending. But I will say on my end, I didn't push it hard enough as I should have. I told my PT, this comment from the doctor when I was at PT yesterday. And, we really worked on pushing it harder, and I got to, I'd say 7 out of 10 pain levels or, close to that. He kind of helped me push it too. That's how I got to 7 out of 10 levels. So we held that for I don't know, it felt like eternity, probably 10 seconds with him pushing it, and it felt pretty bad, but I got to over 110 degrees. So by the end of week 7, hopefully I'm at 120 at least. And that kind of ties into next little thing on the bullet here. So if I'm not at 120 degrees by the end of next week, then my doctor wants to order some kind of machine that'll help me bend. I'm not really sure what that is. Hopefully I get there on my own without this machine needed, but we'll see. That's something that I need to work on. That's why my week 7 goal is really pushing that range of motion for flexion. And then I'll add in here, so something that's been bothering me, or not bothering me, but something I've been wondering about and kind of stressed about because I see different opinions online with different doctors and whatnot. So regaining your hyperextension after this kind of surgery, I think I've been told by my PT, extension past zeros aren't really necessary, and really puts your new ligament at a kind of susceptible state, because once you're past 0, you're kind of more susceptible to re-tearing your ACL and all that good stuff, which is something that my doctor really reiterated yesterday at my follow-up. And she actually went to a conference recently that kind of touched on the subject, so she had some good insights on that. But basically she kind of said that from her experience, the conference she was at and research and everything, regaining hyperextension is really not beneficial for your function. You don't really need it. If you're someone who's had that hyperextension beforehand, and I have quite a bit of hyperextension before the surgery. My left leg, I can max out this brace within a second, just hyperextending. I can max it out to -10 easily. It's more for a peace of mind, basically, getting hyperextension. And she wouldn't want me to go back to, a crazy -10 type range, but 2 to 3 degrees is what she said is pretty good. It's more for a peace of mind rather than a function. And if you're gonna go to 2 to 3 degrees, you're not gonna be at a bad point to re-tear your ACL. So that was her recommendation there, is I can gain back some, but doesn't recommend going all the way. That's kind of how I probably got into a state where I tore my ACL in the first place. I hyperextended my leg too far. My legs were too weak, so, because I ran a marathon at the time, within 2 weeks of playing that soccer game that I played when I tore my leg, ACL. So I hyperextended my leg. My muscles were too weak to kind of help hold that joint together, and boom, ACL torn. So don't want to get back into that situation again. Got to make sure I have strong muscles and possibly don't hyperextend as much in the future, but we'll see. So guys, that's it. Week 6 done. I will see you guys in next week's video. Hopefully some big things change. Hopefully some good progressions. But I appreciate you guys for watching. Like and subscribe if you can. I appreciate it. And I'll see you guys in the next video. Yep.